very good for joining it. There's a few hundred people on it, all HR professionals. So hope everybody's keeping well. I'm David, by the way, from Retail Excellence. So just a quick bit of housekeeping. So tomorrow at 2, we have a lobby update with myself and our Deputy Chair, Jean McCaig, just following a conference call with Minister Heather Humphreys yesterday. So just to update everyone. Next Tuesday at 2, we have a webinar with some retailers who are now reopened. So we're going to be talking about how they're getting on. So Michelle McBride from Butler's Chocolates is there. Michelle Matton, who's head of people at B&Q, will also participate in the panel. And Michelle's focus in B&Q will be on bringing back colleagues. So that would be interesting from a people perspective. Just for homewares, furniture retailers on the call, we're talking to the Department of Enterprise Business this morning. They've reassured us they'll give us an opening date as soon as possible. Regarding the restart grant that's just been announced, we're talking to local government tomorrow. So local government still don't fully understand exactly how it's going to be distributed. So we'll find out more details tomorrow and share it as soon as we have it. And that's that. So let's kick off. We're going to kick off with one of our partners first for a few minutes, and that's Brendan from Strandon, who's going to give us an insight into what they do and how they can help all HR professionals today. So Brendan, over to you.
David, thanks very much for the introduction, and can I just acknowledge the fantastic work you and your colleagues have been doing. Again, good afternoon and welcome everybody. My name is Brendan Carney. I'm co-founder and CEO of Strandon, HR software company. I just want to talk to you for about 10 minutes or so this afternoon, talk to you about the importance of a HR system and how that can help you through these challenging times. We're certainly facing into a new era. What's the new norm? Nobody knows. I mean, according to all the experts, COVID-19 is going to be with us for years, and that's going to present challenges to everybody in terms of.
Brendan, would you mind turning on your video, please? I think it's off. There you go. Thank you.
Okay. Apologies, folks. I think it was probably better that my video wasn't on. I can blame my son for the haircut I've got in the last couple of days. So we're all struggling with visuals at the moment. So yeah, just to reiterate, Brendan Carney, Managing Director and co-founder of Strandon HR. The area I want to talk about is HR software company and HR software, how that can help you in the new world and managing your people remotely. I mean, it's a well-known fact that the most important asset any company has are its employees, and now more than ever, it's very important to have a system that can help you to manage those employees, stay in touch with them, whether they're working remotely or whatever. And I just want to go through a couple of slides and cover that. Company profile of Strandon. Sorry, Keelan, if you just cover that one. Established in 2001, so we're an Irish company based here in Blanchardstown in Dublin 15. Our software is developed locally, supported locally, implemented, ongoing support and maintenance. So we're on an ongoing journey with all of our customers. We don't just sell software, we sell software and a service. It's an ongoing relationship. Our software includes all things HR, apart from payroll. We interface with all of the other payroll providers, whether it be MegaPay, MicroPay, Quantum. There's probably not a payroll system out there that we don't interface with. So we do everything apart from the gross to net, and that's what a good HR software product should be able to do. Just to move on to our market focus. I suppose the HR challenges are common across all industries, and certainly are going forward if people are working remotely. So whether it be hospitality, retail, care, financial, manufacturing, distribution, HR is HR is HR. But I suppose today I want to talk about some of the specific areas in the retail sector and what challenges you face and what is unique to yourselves. I suppose just to give a brief overview of the Strandon product, and again, it should be the same from any other HR software systems. The back office or the core system, the core part of the application is your HR back office, your HR database, so all of the details that you hold against your employees. And that's very important if you need to contact people from an emergency point of view, that you have all of that information up on a central database, easily accessible. Very important that you have employee and manager self-service. That's key, obviously, now where people are working more remote or whatever. Good workflow management for handling all of the procedures that might be currently paper-based in your organization. So as much as possible, automate any processes that are common amongst your workforce. Lots of reports throughout the application for managing your costs, your overheads, all that type of thing. And another central part of the core application is document management. And again, moving into the new world, very important if you have to issue employee handbooks, health and safety guides, new COVID-19 instructions, whatever it might be, that you can do that in an automated process through document management. And that all comes part and parcel of a central HR system. What I'll touch on at the end will be how we can maybe work with you in terms of providing a solution that will be key to each individual type of business, or it's not a one size fits all, and I'll cover that a little bit later on. Before I go through the modules, just one other key feature of our application is onboarding. So if you're hiring a new employee, you need to make sure that all of the guidelines around health and safety, social distancing, everything that is key to the way you operate, that you issue those documents and guidelines to an employee and you hire before they join the company. So the onboarding process will enable you to get in touch with the person that you're taking on, get them to fill out questionnaires, forms, background checks, GARDA vetting, whatever might be necessary before they join the organization. So that's all handled throughout the application. One of the other things about our software is performance appraisals and performance management. So that's something you can look at maybe in phase 2, phase 3. But the important areas from a retail point of view are your time and attendance. So employees clocking in and clocking out. Our biometric clocks, handprint, fingerprint, probably a thing in the past with the whole COVID-19. So do they log in remotely? Do they log in via mobile app? And again, it's important that your HR provider will give you options about how employees can log in. Managing leave is going to be critical. All various types of leave, now that you have employees either working from home or maybe they've been on COVID leave. It's going to be a nightmare for a lot of organizations that don't have an automated system to get all of the leave types, all of the absence, sick, whatever it might be, recorded on the system. So very detailed leave management module within our application. And in the retail sector, probably one of the most important areas is rostering your staff. Again, maybe you're now looking at extending shifts because of social distancing. You can have only so many people working in a particular shift. So it's going to be important to have rosters that will suit, that you can still keep the business going, still manage the various stores or shops, but maybe increase the number of rosters. So an automated rostering system is something that you should really consider looking at. The other area which we feel is quite important is the whole training and development. So maybe your traditional way of carrying out training courses, gathering your staff in a boardroom or a hotel room or whatever, again, is something that's going to be a huge challenge with numbers and social distance. So LMS and e-learning is going to be very prevalent moving forward. So again, make sure that your HR software system has got that capability. Sorry, just something popped up on my screen. And that video still going? So yeah, LMS e-learning is something that you should make sure that HR system has. The most important thing, again, when people are working remotely, is that the application is cloud-based, so it can be accessed from anywhere. We've got a number of customers that have just been in touch with us saying how glad they are that they have moved to the cloud because of trying to stay in touch with people and stay in touch with their current infrastructure. but also mobile app. So making sure that employees can access the application on their mobile. So whether that be requesting leave, clocking in, clocking out, shift swaps, if an employee can't do a shift because they're suddenly sick or whatever, they might request to do a shift swap. And a big part of that then is enabling the company to advertise or to publicize availability of a shift. So rather than having to make 20 or 30 phone calls asking Mary or John, are you available to cover a particular shift? You can advertise a shift through the app, and you can target that at specific roles, you can target it at specific locations, and the employee can then say, yes, they are available to work on the shift or not. So that has a huge time and cost saving and creates great efficiencies. So what that slide there is trying to present to you is the modular approach to rolling out and implementing a good HR software application. So Keelan, you can move that on if you don't mind. Some of the clients that we work in, that's why I said earlier in the presentation that one size doesn't fit all. Every customer or every company has various requirements, varying requirements. So whether you're in financial services or in retail, everybody will want a basic background core HR system, but budgeting might be important to a financial company, rostering important to a distribution or manufacturing company. So some of the customers we work with in the retail sector are the likes of Nordan, Topaz, Circle K, Mr. Price branded bargains there using our application across 50 stores nationwide. Primeline from a logistics point of view, Nordan, Versatile Group, McCabe's Pharmacy, 28 stores, and they're managing all of their rosters, all of their time and attendance, and feeding into payroll. Again, as I said earlier, creating huge efficiencies and cost savings. So trying to streamline the payroll process as much as possible and streamline the management of your shifts and your rosters. We work with lots of different companies in different industries, and they all face the same challenges from the point of view of payroll and multiple payrolls. If you've got a couple of different outlets or shops or stores, we configure and work with you in terms of implementing that as efficiently as possible. So I've been asked to keep the presentation as brief as possible because I know there's quite a few items to cover. So moving on to the last slide, Keelan, just want to say to you that it's very hard for a software company like ourselves to say what offer we can put in place to help an individual company, whether it be retail, manufacturing, whatever. It very much depends on what your main challenges are. And what I'd like to say to you is that, you know, lift the phone. My number, my email address is there on that slide. It'll be issued to you afterwards. Lift the phone, talk to us. We've had to already work with some of our existing customers through this difficult period. We'll also work with any new prospects in terms of addressing what are their main challenges. So if your main challenge is remotely managing your staff, you need a mobile app, you need a rostering system. We'll look at working with you, making sure that it's not cost prohibitive. And it's important that in the current challenging times, people aren't afraid to invest in good software applications, because it is key that, as I said in the very first slide, you stay in touch with your employees. So don't be afraid to lift the phone, talk to us. We'd like to think that we're affordable, we're flexible, but most importantly, we'll address your challenges and your needs. So we're happy to discuss how we can help you, and hopefully we'll all get through this together. And I'd say what will be the new norm, we don't know, but it's new and testing times for all of us. So please talk to us if you need us.
Thanks, Brendan, for that, and we very much appreciate your support. So while Keelan brings in Tommy, just if we can think about watching the RTE news on the evening of the 8th of June, RTE will have 18,000 stores and high streets reopen, and it's all going to be very positive. In fact, it's going to be the biggest ever jolt to the economy in the history of economics. But also we're going to have shopping centre tenants looking at the news on massive amounts of stock, big rents coming, and they'll be considering that they have to wait 2 months and 2 days to open. So it is good that Leo Varadkar has said there will be some potential loosening of the measures and the phases, because we simply don't see that working for all of the shopping centre guys. But anyway, that was just by way of filling some time before we get Tommy in. Tommy, live from Cork, how are you?
I'm good, David. I'm very good. How are you doing?
I'm enjoying all the tsunamis of calls and emails. Are you enjoying your tsunamis?
Absolutely. It's what we do, David. So, we're here to help. So there's been a few tsunamis over the last couple of months, but look, we've loved the work. It's 13 years, David, next week that we've actually signed up for a support mechanism with you guys. So look, we've been through a lot in that 13 years, so we'll face this down with your members as well.
No, and thank you and your team, Tommy, because I know you're probably close to 1,000 emails and queries and calls. And I've told my team we're not HR experts. Every HR query goes to you, and we'll deal with the legal stuff, the rent stuff, the rate stuff, the grant stuff. The minister has our office, so, and that's all good. So look, we're going to hand over to you, Tommy, and you're going to take us through some queries. Keelan is standing live, so we'll try and deal with some of the key questions coming in at the end. So, Tommy, best of luck and thanks for your support.
Thanks, David. All right, good afternoon, everyone. I think my video might be coming up there shortly. Tommy Smith and Tom Smith and Associates, and as I introduced with David there, look, it's 13 years now next week that we linked up with Retail Excellence Ireland, and we've provided support for members over that time. And I think, look, it's been a challenging period in the last couple of months, but from the initial phase of closures, Paddy's Week, through to the more incremental reopenings, look, we're trying to stay on top of things with you guys, and happy to do this webinar. All right. What I will say is, you see the slide there now. HR is one part of what's going on now. I think everybody has a role to play in managing COVID in the workplace, from you guys as employers, and your employees have responsibilities. Obviously, Retail Excellence are involved as well in terms of government lobbying. HR is involved, but also, you need to lean on people like your health and safety advisors. For those of you in food, your food safety and your hygiene consultants, insurance companies, and I think an important but maybe understated support is going to be occupational health, and that's why we have Dr. John Crowley involved in today's webinar as well. Because if you look at the government documents, occupational health is really put in capital letters and bold font on it, more so than before. And I think, guys, webinars like this can summarize things, but you really have to get knuckle down yourself and download things like government documents. And the return to work safety protocols is going to be a big part of today's webinar. But you look at the NSAI and the documentation you get through REI and ourselves. So we've given out documentation through REI, but also via our LinkedIn page, that documentation is available for you to download. Okay, Keelan, move us on. And another, I suppose, I always start the presentation, sometimes it feels like I'm just saying disclaimers, all right? But like, there is an abundance and stuff that I could talk about today, and I'm trying to keep it relevant and I'm trying to keep it short, because I know people may have webinar fatigue at this stage. And another disclaimer I will always say is, look, HR and employment law, it's such a personal thing to employer. I can give broad strokes, we can give general advices, and I think Dr. Cowley would be the same, but that when it comes down to specific circumstances, things like your terms and conditions with your employees, existing precedents, customs and practices, are something that's, we can give broad strokes, but again, it's not employer specific advice. And certainly on the more employment law related stuff, we may go into things like redundancies, things like people with underlying medical conditions. You possibly need to get, customized individual support for each of those scenarios. Okay, Keelan. So, look, in considering all the things that are out there at the moment, guys, I've tried to break it into two things. So part one, we're going to look at is reopening considerations. And then part two later, we're going to look at is more kind of living with COVID after that, okay, in the workplace. So as we now go into part one, I'm going to start really with the government protocols. So I suppose some initial comments was that, Saturday, the 9th of May, after a day or two of leaks, I think I certainly spotted in the likes of RTE and the Irish Times that there was, some leaked headlines on these return to work protocols. But guys, there's no substitute, again, in a webinar like this. You really need to download that document. It's 24 pages of glorious small print, but just get it and read it, because that's the detail. The guys like me can give you headlines. Guys like me can give you tips and summaries, but you got to all read that individually yourselves, all right? It's a living document. The government are very clear on that, okay? You need to keep your ear to the ground. We'll keep you advised, or I will keep you advised. There will be changes to it. If you even look at one of the tips, one of the leaks possibly was temperature checks, and that was one of those, you know, stark things on Friday the 8th that was mentioned. But really, when it came to it, it's barely mentioned at all in the document. It's just saying that keep an eye for public health advice as things change. So this document will change over time as we learn for things that are working and not working. Another point on the document is, in general, is that it's mandatory. Okay, so the HSE are the lead agency out there who are inspecting and can enforce elements of that. Those protocols onto you, okay? And again, I wouldn't be surprised over time if maybe it's brought into kind of, you know, workplace regulations added onto the likes of the health and safety law, all right? But even as it is right now, you have to treat it like it's what you have to do, all right? And interestingly, just remember, guys, that while overwhelmingly it's an onus on employers to do it, the document does give very clear guidance as well to employees, okay? Because underlying health and safety law, employees have obligations to take reasonable care of themselves, take reasonable care of others, all right? And that's still mentioned again in this document, okay? So as you guys are preparing your own policies and preparing the likes of inductions, it's something to remember and remind employees that they really need to get on board with the hard work and the policies that you go to prepare. Okay, Keelan? So again, guys, this isn't necessarily a complete list, but I've kind of picked out kind of 7 or 8 maybe headings and topics and things from the document that you really need to be conscious of, all right? And the first one is the concept of this pre-return to work questionnaire, okay? So 3 days before everybody returns to work from an absence, right, you need to send out a questionnaire to them. Look, the questions you need to ask them are quite standard and they're contained in the document. And look, there's an abundance of templates out there for these questionnaires now. I scroll on LinkedIn and I see kind of 4 or 5 various practitioners. We have one. If you want, you can hit us with an email and we can send one out to you. Or actually, guys, a very good resource, and this is one of the takeaways from today, there's a very good resource section now on the Health and Safety Authority website. That's the HSA, okay, .ie. You can download templates. So a lot of the stuff I'm going to talk about, things like your contingency response plan, things about risk assessments and stuff like that, there's a very good section on the Health and Safety Authority website now. But everybody who leaves work or is coming back to work now, or again, if there's an absence in the next while, they need to do one of these pre-return to work questionnaires to confirm really that they're not suffering from any of the underlying symptoms of COVID or that they haven't been in contact with someone from that. Now, what you need to consider, guys, as well is, you know, who takes that information from them, okay? Because you need to consider the likes of GDPR considerations, that you can't just have those questionnaires flying around the place for every line manager to be ringing and storing, okay? You need to have some structure and control over how that's scheduled, okay? So another issue then is induction, okay? And look, what I think sometimes for those smaller businesses listening in today, I think sometimes you don't maybe do yourselves justice compared to bigger business, because you have all the work done, you just maybe don't put the proper label or organization or structure on it. So what I mean by that is, look, there's a lot of hard work to do, guys, in preparing for opening now. There's lots of boxes you have to tick in terms of the stuff I'm going through now, and just elbow grease you have to get in front of a computer typing up policies, researching policies, all right? But what you need to do then is bring it all together, all the work, all the effort, in the likes of a PowerPoint presentation, the likes of this, or send out people an email with 6, 7, 8 documents that you prepare, put them all together into a pack and make sure you go through that with everybody. I think Brendan was mentioning it there, the likes of Strandom can, you can structure the likes of an onboarding or an induction, and you need a COVID specific one, but you have to do it. It's specifically stated, guys, all right? So you just need to bring everything you're doing together into one kind of structured training session. That's your COVID induction, all right? Your worker representative, okay, again, this is mandatory, all right? I mean, these return to work safety protocols were a result of the you know, the economic, you know, employer labor forum. So, you know, the likes of employers and unions got together to work with government on producing these things. And one of these things is a worker representative, okay? Now, the number of worker representatives that you would have, right, will depend on the size of your business and maybe the geographical locations you have. So for example, if you're one small shop, maybe one worker representative will do. If you're a large supermarket, you may need a worker representative for each department, deli, kind of, you know, stores, ambient, tills, that type of thing. Or if you have, you know, 5 pharmacy locations, you might need one in each pharmacy. But really these guys, as well, on top of the basic induction training, you really need to involve these worker representatives more, give them more training, let them be that conduit for communication between the employer and the employee. Right? And I'm thinking these worker representatives as well, when we come on to the next part of the presentation, maybe things like grievances or employee concerns, right? You tell these worker representatives that, like, they have a role to play in that as well, that if anybody's concerned, maybe has questions or doesn't really want to approach big, scary management or business owners, these worker representatives should be approachable and that they can help mind people's concerns and again, be that conduit for communication up and down. All right. Again, I'm going to mention when I talk about the contingency response plan, look, a lot of what we're talking anyway is stuff that you'd be actually copying and pasting into your contingency response plan. But you're supposed to have an internal COVID-19 team of people who have the access and the skills, I suppose, to be able to risk assess and scenario plan. All right. Again, if you look at the Health and Safety website, you can download guide notes and templates for what is my contingency plan. It's a great resource to have. All right. But really, this is where, you know, you get in there and you stress test and you forward plan and look at possible scenarios and how you as a business are prepared to deal with it as this COVID situation progresses. Okay, Keelan? Guys, the protocols also have the concept of this isolation room. All right. So what you really have to look at in your place of work is a room which is empty, which is disinfected. Ideally, it's behind a door, as the protocols would say. All right. And you need to clear a path through it, basically, is what they say. So that really, if anybody is at work and starts to feel unwell, they're migrated over to this room. And that's where they stay, perhaps while you ring the likes of a Dr. Crowley or your occupational health support or doctor, and you try to get some more advice as to what this person should be doing. All right. Your contact log book. All right. Again, this is something you have to have, guys. So, you know, we get on with it. You know, you if someone in the future, COVID isn't going away. All right. And if you listen to as Brendan was saying, maybe, you know, you listen to what the head of the HSE was saying recently at the government body, they're now talking about years. You know, they're now using that word. All right. So someone in your business in July, in August, and September is going to ring you to say, I don't feel well this morning. I have a snotty nose. I have a cough. I have a temperature. Right. And this is where your scenario planning is going to, what then happens? Because that's going to be a very serious work event now. And what you're going to have to do is consider, well, in recent times, who else has worked, let's say, more intimately with that person? So you guys have delivery people, two in a cab out on the road. You have certain work tasks that just requires people to work, you know, closer than would normally be comfortable with each other. You need to have a contact log book so that if John Murphy rings you in and says, I have a temperature, I'm feeling very unwell, right? They get tested, and if they're positive, and even before they're tested, you can look back in that logbook and you can talk to the 2, 3, 4, 5 people who you may put on precautionary leave as well while that situation is managed. All right. Mental health and well-being. All right. Look, again, COVID is still here. I mean, at the moment, of course, as business owners, as HR managers, you know, senior management, you guys have a hell of a lot of stresses going on now. The type of stuff that I'm talking about, you know, it's outside of your comfort zone. You know, this is the support type of, you know, HR and safety stuff that you guys like to try to avoid. I know that. It's how I feel when my accountant gives me homework to do. All right. But you need to also understand from your employees' point of view, you know, that there's family stresses, there's childcare stresses, there's the health of loved ones stresses, there's financial stresses. All right. So especially perhaps those of you, dare I say, who may not be more naturally minded to have that cuddlier side, you need to develop it, guys. You need to look at the situation in the next while where be very conscious in how you behave and how you deal with people, because their mental health and well-being is going to be very important. And that is a clear, again, well-publicized part of the government document, all right? Consider things like an employee assistance program, all right, which brings supports available and is available for most of the large healthcare providers. You're going to be introduced to Dr. John now very, very shortly, likes of a relationship with your occupational health provider or something. But again, you need to get on board with. Give information, download supports, have information there. Use your worker representatives, all right, to make sure that they're on top of the team and making sure that everyone's there. And communication, guys, simple thank yous. Thank yous to your team, all right? Even the concept of, perks or bonuses, all right? I know even, I was talking to the lads in the BTU gift card. I know, the plug, but they are attached to Retail Excellence. But again, the one-off voucher of €500 for 1 year only has been diluted, that you can give them a couple of different vouchers once you don't cross 500. So, again, thank your staff, appreciate your staff for the effort that they're putting in, okay? And again, a final comment from my point of view on it. Again, look, the Health and Safety Authority, to be fair, I'm going to give them credit. They are practicing what they're preaching in terms of support, because they have produced that great asset of templates on their website. But they are going around inspecting. And look, I know for a fact there's 4 or 5 people who told me they're dialing into this webinar who have been inspected, who have had a HSA person visit them, most especially now, while not everyone is open. So if you are open at the moment, right, you're certainly in a smaller pool of retailers, and you could well have a visitor from the likes of the Health and Safety Authority between now and June the 8th, all right? But look, their overarching thing is to be supporting you to begin with. They'll look at what you've done, they'll give you a few tips, they'll give you a bit of guidance and advice. But obviously, if you don't make reasonable efforts, they do have the power to, if the carrot doesn't work, they can get the stick out, okay? So it's definitely worthwhile reading those documents intricately and doing what you can to get up to speed on them. So what I'm going to do now, Keelan, is you might swap over to Dr. John Crowley, who can certainly maybe give you his thoughts on reopening considerations from an occupational health point of view.
Good afternoon, ladies and gentlemen. Retail Ireland, thank you very much for inviting me to present today for this webinar. My name is John Crowley. I'm an occupational health physician in Cork. I've been dealing with COVID now since before it actually became a national emergency, as we've been tracking it really since late December and January. I'd like to introduce the concept of this presentation, where I'll allude to the role of occupational health for you, the retailer and the employer, from, let's say, a macro level, and then after a few introductory slides to the necessary steps that you should take as an employer, we will talk about specific scenarios that relates to employees as well. So the role of occupational health is really a very central one now in this COVID management. It was highly featured in the government document on the 9th of May that Minister Humphreys published. And we all have key roles now to play in protecting the welfare of your team, your colleagues, yourself, and of course the customers that engage with your businesses. What occupational health does is it assesses and manages the impact of work on health, and also the impact of health on work. So what that means is the impact of work on health is clearly in relation to COVID at this moment in time. And how is work going to impact on the individual's health? So we'll talk about different scenarios and different background medical histories that need to be considered. The impact of health on work applies to the employer. How is the health of your employee going to impact on their work? Occupational health benefits the employer and the employee by providing impartial, evidence-based, objective assessments of scenarios. And this ensures that a company approach is consistent. It is then a policy-driven approach which sets precedents and can subsequently aid in the attendance management of your team, and other aspects of your engagement with your employees. Regarding the key steps for occupational health, on-site visits are of consideration. While a risk assessment is taking place, the risk assessment can be delivered by the employer, but this is only one aspect of the chain of events that needs to be put in place. The return to work safety protocol requires the employer to put these risk assessments in place and to do something about the findings of your risk assessment. Occupational health can assist in discharging your duties as an employer to provide a safe place of work. And this instills confidence in both your team, your employees, your customers, and as well your third parties that you engage with, be it delivery personnel or otherwise. And lawyers now are also stating that due to the mandatory measures that have been published, the involvement of occupational health will assist the employer in dealing with COVID-related workplace claims later down the line. In terms of this risk assessment, it needs to be done in conjunction with health and safety. That can be you, the employer. It needs to be done in conjunction with HR, and it needs to be done in conjunction with legal opinion as well. This is all best practice, of course, and needs to be modified on a case-by-case basis. The occupational health recommendations are then made based on a combined risk assessment between your workplace assessment and the assessment of the individual that may be concerned. As well as this, COVID is a continuing risk, and occupational health should be available as a continuing support. We all are learning on a daily basis as to the new developments in terms of COVID, and we are really, unfortunately, only in the start of this pandemic, and there is quite a journey ahead. Next slide, please, Keelan. So this diagram gives an idea of how an overall occupational health risk assessment is produced, and it goes back to my point on the workplace risk assessment being undertaken. Now, regarding your workplace risk assessment, what measures need to be put in place? Next, if you go for the next slide, please. So your risk assessment is going to be for retail, and you need to consider engagements with your customer-facing roles. You need to consider engagements between your employees. You need to consider the engagements within the warehousing area of your business. You need to consider engagements in the car park. You need to consider engagements with deliveries and interactions with deliveries, for example. Further advice is freely available on the HSA website as well, and of course besmart.ie. Regarding the medical and clinical vulnerability risk assessment, that is tailored specifically towards an individual, and that should be undertaken if there are underlying past medical histories that raise concern in the context of COVID. The individual is broken up into numerous categories: the very high risk, the high risk, the increased risk, and the employee who does not have a past medical history, although still is at risk of COVID-19, of course. In conjunction with this risk assessment, then an overall risk assessment is provided by the occupational health physician, where this incorporates health promotion with particular emphasis on mental health, as well as other lifestyle measures that should be advised. Next slide, please. I have included information here with hyperlinks for the employers and your businesses, because these are exactly the links that should be incorporated in your induction packs on a return to the workplace. This link, which you can go to later because these slides are being made available to you, outlines a very informative government-backed video on the signs, symptoms, physical distancing requirements and transmission methods of COVID-19. As well as that, hand washing is an absolutely critical component to everybody's daily tasks, and there should be no exceptions with it. Everybody should be hand washing extremely regularly, as well as of course maintaining social distancing etiquette and of 2 meters, and also ensuring that individuals are not in the same environment as another individual for 15 minutes or more, unless absolutely necessary. Next slide, please. This is a wordy slide. I've put it up here for your reference later on, but I would like to outline the key components of it. This is to do with the hierarchy of controls and how to reduce risk. And this is all in the context of COVID. And if we look at the steps that are taken, we start at the top. How can you eliminate the risk? We eliminate the risk by implementing home working, but of course, given the retail industry, that's an almost impossible task. So if that's not possible, how can we mechanize the process? And a simple example of that, which is already widely visible in the community, is in supermarkets. There's been a radical shift from the teller and the checkout to the automated self-checkout option. That's a perfect example of substitution. Engineering controls are also available to see in the community, and that would include, let's say, in pharmacies where there is social distancing practices very visible, there is floor markings very visible, the perspex partitions are visible. They're engineering controls. But as we go down this list, you are entering less and less effective controls for the reduction of infection transmission. If we go on to administrative roles, this would be the lead COVID officer in your organization, supervising that there is compliance with social distancing, exploring how people travel to and from work. I will go back to this later in the presentation, but it's very important to understand actually not everybody is fit to use public transport on medical grounds. And if they can't drive to work independently, or if they can't walk to work, or if they can't cycle to work, then provisions are going to have to be put in place to facilitate that individual. One needs to consider staggering arrival times and exit times. And of course, just like we're doing right now, the implementation of remote meetings needs to be commonplace. As well as this, last in every hierarchy of control is the implementation of personal protective equipment. It is the least effective means of reducing infection transmission when other more effective measures just outlined are available to the employer. Next slide, please. So occupational health should play a role after the workplace assessment and risk assessment has taken place. Occupational health should also play a role in advising you how to undertake your adequate risk assessments. When those risk assessments are undertaken, then the medical clinical vulnerability risk assessment is done. And that's a hyperlink, again, in yellow, for the categories of employees who fall into the various risk categories. So if, for example, you have an employee who has a particular heart condition, like a specific valvular disease, or if you have an employee who has recently undergone treatment for cancer, or if you have an employee who has been an ITU, an intensive care patient in the last 12 months. These are all considerations that should be reviewed by occupational health in order to determine that their position within work is safe. Moving on from that, excuse me, I beg your pardon, Keelan, the overall health promotion then includes references there under mental health, which are further hyperlinks to mental health resources for the employer. And these are all free resources that you can avail of, as well as free counselling services. So while there are EAP services available through many private organisations, there are also free services available to employers and employees. These counselling services are endorsed by both the HSE and the National Health Service within the UK. While undertaking an assessment with an employee as to their return to work with an underlying medical condition, be it mental health condition or a physical condition, it is extremely important to explore and discuss the employee's ideas, concerns and expectations regarding their return to work. There has been fake news circulating regarding COVID. It has been detrimental in many respects to the appropriate management that should be taking place. We have information about certain drugs making one more at risk to COVID, for example, or less at risk, as President Trump is practicing at the moment under questionable guidance. So we have to make sure that the employees' personal concerns and expectations of their workplace are explored, and then specific return to work advice is given for that individual, incorporating their past medical history and their specific role. Thank you. We must never forget, this is a biological hazard. COVID is a viral disease that is in our community and will be, unfortunately, in our workplaces. We have to do everything to reduce the risk of that, wiping out our businesses or actually closing our businesses due to public health implementing stringent contact tracing, etc. The potential for that does exist, although I must also support Tommy's comments regarding the HSA. They will do everything they can to support you in making your workplace as safe as possible. These requirements, there's a small bit of repetition, but these requirements are mandatory, and it is critical that your safety statement is updated to incorporate your COVID measures and your COVID risk reduction measures that are taking place. This needs to be reviewed on a regular basis. And unfortunately for Retail Excellence Ireland and your members, retail is a higher risk environment than, take for example, a controlled office environment like an accountant's office. No one size fits all for a rollout, so it won't be a copy and paste exercise from the HSA website. You must make reasonable recommendations to protect your team as per their roles. Go ahead. Yeah. So at this stage, I'll hand over to Tom again, and I'll be stepping back in again to give you a more case-specific approach to managing specific employees. Thank you, Tom.
Thanks very much, John. Guys, you're back with Tommy again. I am seeing all the questions fly in, guys, okay? And look, there's still a bit I want to get through, so you have to bear with me. So what we might do in terms of the questions is, look, myself and my team, what we may do is just print out all the questions and divide them up and get back to you ASAP between this afternoon, this evening, and tomorrow, okay, if that's all right. So for any of those questions that maybe aren't answered as we go through the rest of the slide, because look, I'm conscious that even in preparing as detailed a webinar as you can, a lot of you guys will have questions that we just won't get to, or will be personal for you guys, all right? So just coming back to some points then on maybe roster planning, all right? I think, Keelan, did you skip on a slide there? Will you go back one maybe, please? Yeah, so look, the safest and simplest way of deciding who comes back first is seniority, guys. It's the age-old HR way, you know, the opposite of last in, first out, you know, that if you're looking at who to bring back, you go to your longest servers first, okay? Exceptions are reasonable, are logical, are permitted if there's things like critical skills. And, you know, I've used some examples there, like support staff with skills, accountancy, HR, you know, guys who have forklift training when others don't, all right, or a particular type of experience that you need in your business. But really, if it comes to a pound for pound comparison, all right, you know, seniority trumps it, okay? And I suppose, you know, a word of caution, if you start picking and choosing who you want back now, you do run the risk of grievances either right now with people who maybe would be miffed that you overlooked them, all right? Or even if they're prepared to stay out now or happy to stay out now, you know, you do run the risk, you know, what happens when the likes of the pandemic unemployment payment, or PUP as it's been deputized, you know, when that amends. So, you know, someone may not kind of create a grievance now, but in 3 or 4 weeks' time, as is kind of kites are being flown that payment may be looked at, you know, people come back to you then. So there may be a grievance created now that isn't actually executed until later on, all right? And another basic in terms of your roster planning, guys, is always go back to your contract, your terms of employment, your handbook, the rules of your business, and check for flexibility around hours of work. Does it say 40? Does it say 30? Does it say kind of up to 30? Are they on bands of hours? Okay. Okay, Keelan, you can roll it on. One thing, guys, and this is a particular bee I have in my bonnet, right? And it's just something I want you to bear with me on, okay? I think the tone and the content of the first communication you go back to a colleague is important, all right? A lot of people, I think, are more inclined to say, you know, hi, how are you? Are you interested in coming back because we're looking at reopening, all right? And I think you're creating a problem for yourself there, because if people they feel they have a choice maybe then, okay? And they feel that they may then come back and say, well, I don't really. And then if you come back and say, well, I kind of wasn't asking, I was kind of saying we're back and I need you back, you created a problem, right? I think the concept of layoff is a particular relationship between the employer and the employee. So look, realistically, you guys had to lay off your employees probably around Paddy's week for most of you guys, because you had to close. So you did not have hours, therefore you placed them on layoff. Really, as soon as you go back to a colleague and say, hi there, I have hours for you again, you know, the technical relationship of you having them on layoff, it's already gone at that stage, okay? So I think you need to go in with the tone of, hey guys, good news, we're getting back in the game. I have hours for you effective of next week. And I think then keep going and say, we've done all the work. We've been painstaking work, listening to boring HR webinars, reading up on government protocols. We've all the health and safety stuff done, guys. It's kind of brilliant. Go in with a strong message, okay? Yes, employees, you know, there will be an element of employees are reluctant to return, all right? But I think you then manage their reluctance in a second point of the conversation, okay? It's important for the first point of the conversation, you get the message very clear. Off, lay off, because I'm offering you hours, all right? I've taken all the safety precautions. We're gonna be, you know, properly, have all the policies prepared. We're going to have everything done to keep you safe. That's point one, all right? Then, hopefully the majority of people will be happy to come back. They'll be prepared to come back. You then have those obviously people who will be reluctant, okay? I think the point is you listen at that stage, but it's important to probably separate out message one from the conversation you're then going to have about their reluctance. Okay, Keelan? So, look, many employees will have a reluctance or an anxiety for return, all right? So again, I'm kind of saying to you that you're then engaging with them on their reluctance from a starting point of, well, you're not laid off anymore, but talk to me about the reason you're asking not to come to work, okay? Now, guys, if you go back to this government protocols document, look, you know, I'm going to talk to you again about, you know, having kind of a sympathetic ear to where employees are coming from. All right. It is a very stressful time out there. All right. People do have underlying conditions. The government protocol is very clear that now more than ever, employers do have to, take seriously employee concerns, and there's a big difference, I suppose, between, having a situation where employees are reluctant to return and allowing them out versus employers being a little bit more straight with employees in terms of considering disciplinary action. All right. So looking at some of the main reasons why I feel people may not want or maybe reluctant to concern. Look, guys, childcare is a very real thing. I mean, with the schools being closed, with childcare organizations and creches being closed, people with children, like, I mean, really employers have to just accept the fact that, it's very, very difficult for people with children to come to work now. All right. I think people with underlying conditions, right? People who may be living with people with underlying conditions, or people maybe suffering from the likes of mental health. That's where I think, if you bear with us, Dr. John's going to give you kind of some scenarios and how he can help in situations like that towards the end of it. Okay, Keelan. So I think try to create your own process, right? Stepped process for managing the reluctance of employees. So I'm going to go back to the fact that you've already made clear to them, okay, that I've offered you hours back. So the technical concept of layoff is over, all right? Listen to why they're now saying they're not sure about coming back. Ideally, get them to send you some notes or an email or something where you have more of a written explanation where they're setting out their position to you as to why they're reluctant to come back. At that stage, then you seek, support your HR department or your occupational health, or maybe health and safety. All right, we're here for REI members, guys. You all have some complimentary hours, courtesy of Retail Excellence with us, all right, or your employment lawyers or whoever. But seek support on a case-by-case basis, and then you make a fair and logical decision, again, based on medical information, based on an understanding of the employee's position as to your acceptance or otherwise, I suppose, of their reluctance. But just remember, guys, if you're ringing the likes of me, expecting me to tell you don't have to accept, a person's position, it's going to be difficult, because the likes of the Workplace Relations Commission, they're a government agency, going to be listening to the government position on employers needing to have probably a more sympathetic ear than ever before to understanding the plight of employees who have concerns about returning to work, most especially because of childcare, most especially because of health considerations. All right, Keelan. So I suppose in terms of labour costs as well, all right, guys, while Paddy's week was probably the busiest working week I ever had, all right, with generally the queries starting before 8 in the morning and finishing about 10 o'clock at night, it was actually, in a weird way, there was very few grievances or employment law issues or dramas came from it, because it was so one-dimensional and socialist in its execution, in that everybody was in the same boat, that the government was just shutting down the country. So what grievance could an employee have? I think the phase we're in and we're going to be in over the next couple of months is going to be different, right? Because like I've already alluded to, who do you take back? How do you take them back? Managing things like the employees' reluctance to come back, all right? So we are already seeing now, employment grievances and legal issues coming up. So, employees raising the likes of health and safety concerns, again, like, you have to be very careful in the likes of health and safety law. If a person raises a concern, if they're seen to be victimized or penalized, right, it's a very, very dodgy area of law to get sued under, all right? Discrimination and equality law. So again, as you're choosing who to bring back now, who to allocate hours to, and even down the line, if unfortunately, but maybe inevitably, redundancies come in, you've got to be very careful under the likes of equality law as to how you treat employees and allocate hours, under kind of things like gender, under things like family status with the likes of kids and childcare, under nationality, under sexuality, stuff like that, under equality law. Unfair dismissals, look, there just are going to be dozens and dozens and dozens of unfair dismissal cases later this year for selection criteria for redundancy, all right? I'm going to touch on that now in a little while. And there's going to be payment of wages claims. So look, I'm doing this 15 years myself now, and I sat for 40, 50, 60 cases in front of what was then the LRC, in front of a rights commissioner, for payment of wages claims for wage cuts brought in the last recession, 2007, 2008, 2009. They're just they're very hard to win, guys, because, you know, a wage is set out in the contract, it's accepted, it's given. You absolutely need to get written acceptance if you're bringing in a wage cut. And there's just some quirks that have yet to be ironed out with the wage subsidy scheme, guys, okay? That, okay, you know, let's say you're claiming up to 70% for an employee in the wage subsidy scheme now, but because you've kind of been closed, they may not have been working anywhere near 70% of their hours. So, you know, they've been overpaid hour for hour. But now as you start to give them back work or need them for work, you know, are they going to suddenly start working 70 and then upwards of 80, 90, 100% of their hours? And are you going to stick them on the wage subsidy, or are you going to start topping it up? And guys, one thing in retail to be very conscious of is minimum wage, right? Because if you're claiming the wage subsidy scheme for people who are on or close to the minimum wage, right? Just be careful, because if you're getting even 70 up to 85% of their wage under the subsidy scheme, but you're working them 100% of their normal hours, you just need to double check that they're actually getting the minimum wage when you divide the money they're getting into the hours they work. All right. Okay, Keelan. So obviously right now, in terms of people who you can't bring back, you know, I think David Fitzsimons was saying last week that, you know, 70% seems to be the average that people are bringing back. I was actually quite surprised at that. I thought it might be a bit lower, but so there's still a cohort of people who you can't bring back now maybe and don't have hours for. But at the moment, they can continue under this PUP, all right, scheme on welfare, or the wage subsidy scheme on revenue, whichever you guys have engaged with. Right, and as long as that lasts, I suppose. Now, like I said earlier, the flying kites said it might be changed in June, but it's still there right now. And at the moment, okay, although this is getting an imminently important issue, there was, you know, this protection from redundancy claims. So usually employees can claim redundancy within certain timelines once they hit layoff. All right, and they've kind of been paused really to give employers a chance and stop kind of redundancy claims. But at the moment, the deadline for that is at the end of May. Now, look, I can't see a scenario where it won't be extended, but look, it's still a case of watch that space. But these protections on that slide, they won't last forever. And at some stage, kind of as we hit autumn, as we hit early winter, you know, depending on where we're at as businesses, there'll be difficult decisions to make. So look, well, what are options that will happen then? Well, look, you go back to, I suppose, the standard, good old-fashioned type of options that employers generally seek in situations like this. So, I mean, obviously, ongoing layoff is still an option, but you're back to probably the more regular job seekers benefit, all right, of which has historically been 203 per week. Okay, and importantly, well, two things on that. First of all, it'll be based off your 2018 stamps. So if you have newer people who weren't working back then, or maybe foreign workers who weren't in Ireland back then, they may not be eligible for any welfare payment at that stage. But on the flip side of it, then some other employees with dependents may get more than 203. Okay, short-time working allowance is still an option, or I think it's, you know, colloquially termed the 3-day week. All right, where you have somebody who traditionally would work more than 3 days a week, and you've moved them to below 3 days a week. Look, I mean, as a simplistic statement, it's the pro rata of the 203. So if you move someone from a 5-day week to a 3-day week, they can claim for the 2 days that they've been reduced. So they get about the 80 euros they'd get then for that. So you save 40% in theory on their wages, and they get 3 days wages plus there's 80 euros on top of it. All right. Pay cuts are an option, of course, they're an option. All right. But like I said, guys, it is absolutely critical, right, that you get written agreement or acceptance. Or an employee can wait 2, 3, 4 months and then take a payment of wages case and get all of their cut wage back. All right. Hours cuts is another option. I mean, look, when it comes to a flip between hours cuts and pay cuts, if you move people from a 5-day week to the likes of a 4-day week or a 3-day week, at least they feel that the value you place in them hour for hour is still intact. Okay. And again, maybe check the likes of flexibility in your contract as to exact wording of your hours in terms of layoff and short time clauses, which probably you looked at already, but also in terms of flexibility on the hours of work and the exact wording of it. Okay. And look, an introduction to redundancies, guys. All right. I'm reluctant. You know, the more, I suppose, complicated and riskier the employment law phrase or concept, the more dangerous it is to breeze over it in the likes of webinars like this. Okay. Because, so this is the slide I've done on redundancies, but humor me, this is an introduction to it. And I would again recommend you seek specific advice as you actually seriously contemplate and execute redundancies, because you're still firing somebody if you make them redundant, you're terminating them, you're dismissing them. Okay, so there's a natural protection under unfair dismissal law. All right, and whilst you may think a lot of redundancy scenarios are quite logical, there's a lot of particular nuance around legal precedents that you have to be conscious of. All right. One of the first things is it's the job, not the person, that's made redundant. All right. And like a fair procedure and a selection process is critical. So look, sometimes on the phone, people will hear me use the example of if you have 5 people and your order book drops by 20%, well, look, logic will dictate that perhaps you only need 4 now. But it's not as easy as you just one day rocking up to the person who's last in and say, I'm sorry, my friend, you're gone now. That could well be viewed as an unfair dismissal, because procedurally, you're expected to try to engage and do something to avoid any redundancy. So ask them all for a 20% pay cut to begin with. And if you don't go there, why would you not considering offering a voluntary package to see whoever may want to move on from you would put their hand up for it. All right. So all of these things play into a process, okay, for executing a redundancy, because it's unfair dismissal is the law you're fighting, not unjustified or unwarranted or unnecessary dismissal. It's unfair. All right. Guys, watch for collective redundancies. Those of you who may have to make, look, unfortunately, a couple of redundancies, just check, in terms of the scale of business you're at and the ratio. If you make more than a certain number of people redundant within a 30-day period, you have to actually write to the minister informing them of that and have a 30-day cooling off period. So just be conscious of that and check the ratios. All right. When it comes to how you might select compulsory redundancies, again, LIFO, last in, first out, it's probably the safest and most reasonable. Look, yes, you could look at a skills assessment, skills matrix, but remember, guys, the more you go into an assessment of people, the more you're rating them and you're ranking them, okay? And if you're going to do it, you're far better off doing it against tangible headings like sales figures, things like attendance records, things like disciplinary history, things like various jobs in your business that they can actually fill, all right? If you start doing it against how nice you consider they are with customers, how good a team member they are, how pleasant an individual they are, then, you're kind of getting into the more, less tangible stuff and more individual opinion, all right? And they're more dangerous ground for doing it, all right? And a big thing in redundancies, guys, a big rock that employers perish on, all right, is alternatives. You must consider alternatives. Go back to it's the job, not the person. So if you decide that my role in menswear needs to be made redundant because I'm the last in menswear, obviously if you have an opening in footwear, or you have an opening in homeware, or you have an opening in the other pharmacy on the other side of town, all right, you have to consider me for that. All right. Now, look, there's a quirk before I move on from the side. There's a quirk on the flip side that if you have reasonable alternative jobs, you don't necessarily have to go to the cost of giving me redundancy. All right. But then the debate will arise around whether the alternative job you have for me is reasonable or not. Okay. But look, that's one again that I'd like you to maybe seek some advice on if and when that time comes into it. Okay. All right, guys. I'm gonna breeze through it as well because I'm conscious of time as well. Is marching on, and you guys are going to be well fatigued and bored with us by soon. So part B is reopening considerations. So let's lash into it, Keelan. Okay. So basically, kind of what I want to frame this is, look, really from what we talked about so far. Okay, over the next kind of couple of months, you're going to have a whole host of brand new policies in your business that you haven't had before. All right. And you're possibly going to have to temporarily amend existing policies for, like, let's say, a COVID-related time. All right. I'm going to refer you again to the return to work safety protocols, because kind of even simple policies like cleaning and personal hygiene, there's a lot of information in the government protocols on that. And sure, isn't the government document the best place for you to pull your resource from? So you can say to employees that these policies are government driven. What I would consider, again, like I'm saying to you on the induction side of it, pull everything together into an induction. I think you should pull every new policy together into like a temporary COVID handbook in your workplace that kind of exists as long as COVID does. Okay, Keelan? So look, guys, suggested new policies. And again, look, I'm definitely saying it's not an exhaustive list, guys. There could be a lot more. Do set out a policy on social distancing guidance and social distancing expectations in your workplace, all right? You guys know the physical layout of your workplace. You know corridors, you know storerooms. Give it a customized kind of, you know, set of information to your employees, okay, on what to expect. Because look, going back to the more employment law side of it as well, if you are going to want to deal with any individual who might not be adhering to the new expectations, right, the first thing the likes of me is going to say to you is, well, show me the policy that you're saying they're breached by not maintaining social distance at work. Okay, so give clear information to your employees on social distancing expectations at work. Cleaning, all right? Look, obviously there's going to be comprehensive new cleaning regime in your workplace. Give the information to the employees on what's expected to be cleaned, when it's expected to be cleaned, who's expected to do it, what equipment, what PPE do you expect them to wear while they're doing that, okay? Personal hygiene, look, guys, for all the fancy Dan technical information, technical policies out there, it really still comes back to probably, I know, Dr. John, you may have a comment on this at the end again, but this comes back to the fact that, you know, the basics of good hand washing, good personal hygiene, coughing, binning tissues, etc. That's still a very, very huge front and center policy you're going to have in work to keep COVID out of your workplace, all right? We've talked about the logbook, right? Again, explaining to your employees, because, you know, you can't be everywhere at once, guys. So if your employees ever have to do something that does bring them into a more intimate contact with a colleague for a time being, you need to explain the concept of the logbook to your employees, and that they need to report to you if they've ever have something that should go into it. Right, Keelan? Visitor etiquette. Okay, look, guys, you know, retail, you're going to have delivery people in. You might have people like, you know, electricians, you might need people like plumbers, you might need rodent pest control. Visitors are going to be coming to your business. So, you know, on a business to business level, you got to make sure with people who are coming into your workplace, you know, the shop fitters could be coming in to put in COVID stuff. You know, you got to get a communication with those guys, you know, as they might with you, to make sure that you both protect your employees and they're conscious of your standards, you're conscious of their standards when you guys mix employees. All right. I put a line in there about temperature testing. Okay. I think it was a little bit of a false flag in the government protocols. All right. It's not mandatory at the moment. I think at the moment the public health advice is it's not needed. All right. If as a business you want to go in there voluntarily and do it, be very careful. Take a note, guys. This is a policy that has the potential to be a hell of a lot more intrusive, a hell of a lot more difficult to implement than any of the other policies we're really talking about now, because of the, you know, the nature of the information you're gathering and how it's stored and how to deal with, you know, employee reluctance when it's actually not recommended by the government, right? But look, it's in there. It may be one. We'll keep you abreast of any further public health advice on it, all right? Again, inform employees of the likes of the isolation rooms you're going to have to create. Advise them not to go into it. Advise them what it's for. It's an empty space being left there, you know, and if they see somebody in there, steer clear of them. Okay. Annual leave is one which I could have put in the next section, which is temporary policies as well, or amended policies. It's one that a lot of you I know probably have been asking about. Okay. So look, while the people have been on layoff, all right, either layoff through work subsidy or layoff through the pandemic unemployment payment, they have not been earning annual leave. You earn annual leave only as time worked. Okay. Interestingly though, they would have got public holidays for the first 13 weeks on layoff. So as they come back, you may owe them a couple of public holidays from Paddy's onwards, okay? So I do think, you know, an annual leave policy for 2020 or 2020/2021 is something you need to consider now, all right? Now, what you can do is, all right, the basic law would be you can place people on holidays, all right? Most employers like to try to give people the best opportunity to nominate their preferred dates. But ultimately, if it comes to it, with 30 days notice, you can allocate holidays to people, all right? Look, what I would suggest you do is maybe, you know, in the next while, if holidays is something you're worried about, set a time in the future. Give them a month to put in their favorite requests, all right? And if they don't put in requests, maybe then at that stage, you're telling them now, if you don't put in requests, you know, we're going to allocate you holidays because by maybe the end of August, we want to have X% of our 2020 holidays washed through, all right? Look, you can allow a carryover into 2021, all right? You could merge the holiday years of 2020 and 2021 into, you know, one 19-month holiday period from now and give them extra time to wash through, all right? But then again, maybe what we might do is be conscious of your current existing annual leave policy, and we might deal with queries on that as they come in. I'm going to make one final comment on it, guys. Remember 1365 hours, all right? Because more importantly for full-timers, if they work more than 1365 hours in the year, all right, they do get their complement of 4 working weeks holidays, all right? So if you think about people coming back now, even though they've missed a quarter of the year, if they worked 40 hours or so before they close down, and if they're going to work 40 hours from now till the end of the year, they may still cross that threshold. So they may still earn their 4 weeks holidays. All right, Keelan? Okay, so existing policies you have as well, guys, that might not be brand new, that you just might have to update and amend and bring in a COVID-specific one. And like, I'm conscious in terms of customer service, and it really struck me in a sobering way, the type of stuff REI was talking about at the webinar last week, that the tactile, enjoyable experience of shopping is now going to be quite a cold experience, and deliberately cold. And you're actually going to be advising your employees not to engage with customers in, you know, an open, tangible way, you know. So you might need to bring in a new type of customer service policy that actually gives instructions to your employees on you know, how not to engage with customers and how to communicate with customers in a COVID way, right? And again, the more you put that in policy and give to your employees to do, the more you can kind of review it afterwards and see if the employees are following it or not. Data protection, okay, working from home, guys. You know, I think if you look at the bottom of the page, I also referenced working from home. I mean, look, it fell off a cliff in March, so a lot of people just ended up working from home without much thought. But now is the time you got to catch up on things like data protection and working from home. All right. Risk assessments should be done on working from home. Data protection policies in terms of the information that your employees have now got at home on the kitchen table while 4 kids are running around them. All right. So you need to catch up your data protection policy. Obviously, these medical questionnaires that are now mandatory for you to do have to become part of your data protection considerations. Even the logbook entries as to who works closer with who has to be considered. All right. Risk assessments, your safety consultants, again, will have a part to play in this. To be fair, I know Sea Change are the partners for Retail Excellence Ireland, and they've definitely, as far as I'm concerned, been setting the bar in terms of information on risk assessments and health and safety. So, but again, whoever completed your safety statement for you should be kind of, you know, consulted with along with the health and safety website to update risk assessments. Okay, Keelan. Okay, guys, travel for work. Look, you guys have maybe delivery people in there. You may have reps on the road, that type of stuff. All right. You may have buyers who would traditionally be going on buying trips. Look, obviously, you know, every company has to create its own policy, but really, travel restrictions apply. These types of webinars, video chats have to substitute meetings that would traditionally be traveled for. All right. Again, go back to what I said about visitors. If you do have to send people out to other premises for whatever reason, again, you need to make sure that they're well aware of how they need to behave in the other person's place of work. And you need to take responsibility for their safety and make sure that you're aware of the place you're sending them into and that they have a fit for purpose COVID policy as well. Sickness and absence policy. Okay, look, you're going to have to temporarily amend or bring in, you know, probably your normal illness policy side by side with the specific COVID absence policy, because, you know, people will still, you know, fall and break their wrist at home and ring in with a broken wrist, and that will go through normal channels, let's say, of, you know, how they get in a medical search and how they may claim illness benefit or how they may claim sick pay if you pay sick pay. That's very different to somebody ringing with a runny nose, a cough. All right, it's going to be handled very differently. And I think I'll be handing over very shortly to John again for a bit of a chat on that. But you need to consider bringing in a separate absence policy to cover COVID-related absences. Okay, and guys, another big one that can't be overlooked is, you know, rest breaks. You know, depending on the size of your business, you could have 2, 3, 4, 10 people in the canteen having a cup of coffee at 11 o'clock at the wrong time. You just have to bring in a more staggered, socially distanced break regime, right? Obviously, you still have to meet the requirements of the Working Time Act in terms of, you know, can't work more than 4.5 hours without a break. You know, they need their main meal break if they work over a certain period of time. And we won't talk about the elephant in the room of this 1 hour lunch break for retail staff. But anyway, that's not the purpose of this webinar. But look, you do need to have a plan for canteen etiquettes. And even if someone is in the canteen, cleaning the kettle, disinfecting it, disinfecting the toaster, you know, whatever they use, you know, bring that into your policy, get your signs up in the likes of your canteen for that. Okay, Keelan? So disciplinary and grievance, all right? There are changes you need to do, all right? I've seen some questions come in relation to it, all right? That, you know, obviously, you know, having 4 or 5 people in a room, meeting notes and representatives for the likes of disciplinaries isn't the wisest thing to do. But at the same time, in the next 6 months or so, you know, employees will annoy you. You may want to investigate disciplinary actions. You know, employees will raise grievances, which will warrant grievance meetings. Okay, so just, you know, consider your workplace. Consider where you can have some people in a correctly socially distanced setting to have the likes of meetings. All right. You do need to consider, though, if people want to be accompanied by somebody in line with your policy, whether you have the willingness to allow kind of the likes of a representative virtually dial in on the likes of a Zoom call where they can still be there and represent their people. Okay. Again, in the likes of grievances, you may want to create a COVID specific grievance procedure, because again, your normal grievance procedure will run, you know, you raise a grievance with line management, then you elevate it to maybe the likes of store management, then HR. Look, you may need to bring in the likes of your worker reps now as your first line of defense, because they may have a better ability than a normal line manager to deal with employee concerns. And guys, a big final comment from me is, you know, whatever inductions, whatever new policies, whatever amended policies you create, just make sure you get kind of a signing form that employees sign off on it. We sent one out kind of, I think we titled it the somewhat cheesy, a contract against COVID. We sent one out through REI a couple of months ago at this stage, but get some sort of a disclaimer signed off that the employees have attended it and accept the contents of both their induction and their amended maybe policies over the upcoming period. All right, so look, I will speak to you once more just to kind of wrap up in a couple of minutes, but for now I'll hand you back over to Dr. Crowley.
Thank you very much, Tommy. Keelan, if you flick on to the next slide, please. Excellent. So I'm very, very conscious of your time now, and we're moving into the afternoon. So what I'd like to do is outline 1 or 2 key points as well. So testing has become more available, as we know. It's becoming more available now to the general public. Facilities exist for 100,000 tests per week. So as a result, you have access to testing for your employees. And the key is test early. And as well as that, public health guidance is evolving and evolving every single day. And I'd like to make this very clear. If somebody is not a positive contact and they present with symptoms of COVID to the workplace, this individual should be tested as soon as possible. This is done through your health provider and your occupational health provider, and the test is done electronically. It's based on the air code of your employee, and the test takes place at the nearest location according to the employee's air code. The result is then transmitted electronically back to the referring doctor, who should, number 1, inform the employee, and number 2, monitor that employee over a 5-day period. This is all still within your 14-day recommended isolation period. And critically, if the employee has a not detected result, which means they don't call them negative results, they call them not detected, they remain under observation for 5 days, where they must be fever-free, and then subsequently they are to be reviewed to be symptom-free for the day 4 and day 5 of that. The occupational health doctor should be monitoring that course of events, and if in the context of a not detected result and not a positive contact case, that individual can go back to work before the 14-day period or moratorium period. So you have the opportunity to get your staff back to work sooner if efficient channels are followed. Now, as well as that, what happens if an employee rings in sick? It's really important to, number 1, do not let them into the workplace. The Humphreys document has 6 key questions, and that is widely available on the HSA. But as well as that, there is online symptom checkers available free, and they're on that hyperlink there. Regarding an employee feeling ill at work, what to do next? That first of all, record the event. That's an incident. The employee should be escorted to a safe zone. Ideally, this is going to be a room as documented in the Humphreys report, but that's not practical in many working environments, including retail. If the employee has driven to work, their car is a practical example of a safe zone to contain any infection spread. That individual then should be sent home, and that individual should have testing organised as efficiently and swiftly as possible to follow the course of events I've just outlined. Regarding another scenario, if an employee is co-inhabiting with a suspected COVID case, so a family member or in shared accommodation, a housemate presents with suspected COVID. Again, the guideline for the employer is located on that hyperlink, but what should actually happen? The employee should not present to work if they are a suspected positive contact, and also that employee should have rapid testing organised as well. Employees with underlying health conditions are a group of employees that require specific risk assessments. It is unreasonable for an employer to assume that it is safe for somebody with asthma or respiratory conditions or autoimmune conditions such as rheumatoid arthritis, if they're on immunosuppressant drugs, to say, well, it's probably okay to do X or Y. I would strongly recommend you don't make any assumptions regarding their safety in work, and do seek occupational health risk assessment for those individuals. The pregnant employee is specifically mentioned as well, and that is because the employee who is pregnant fits into two main categories, whether they are under 28 weeks pregnant or whether they are over 28 weeks pregnant. For the first time in late April, direct vertical transmission between mother and baby has been recorded. So the infected mother now can and it has been shown to transmit COVID to the newborn baby. Thankfully, those babies do very well. However, it just goes back to the risk that the employer places the pregnant employee at, and was that a reasonable risk to take? Take note of that. The employee who's pregnant and less than 28 weeks pregnant is at lower risk than the employee who is greater than 28 weeks pregnant. If your employee moves to the 28-week plus time, she is at greater risk of COVID and the complications of COVID, including early delivery of their baby. And then employees with a vulnerable person at home. This is probably going to be one of the most difficult aspects of management for the employer and occupational health. The role of occupational health is to determine if the employee is fit for their role, not the employee's family members or otherwise. However, of course, it must be taken into consideration if there is a situation that has a high-risk individual at home with a member of your team. It is only reasonable for you to do what is reasonably practicable to reduce that employee's risk of COVID. And that should be tailored to the level of risk that they are exposing their family members or housemates to at home. However, that is all so far as is reasonably practicable. If we go on to the next slide, Keelan, in the interest of time, your occupational health service needs to be accessible, it needs to be contactable, it needs to be rapid in its response, and it needs to be robust in its policy. It also, your occupational health service needs to get your employees in the safest possible position, and of course, in the interests of your business, get them back to work as soon as possible, and of course, safe to do so. But it is not really widely known that in certain circumstances, with the right results and the right history, social history leading towards the testing, those employees are not automatically written off work for 14 days. Phone consultations are an option as well, and of course in-person consultations, but that is really outside the context of a suspected COVID case. Doctors are advised to conduct video and phone and telehealth in the with the suspicion of COVID. However, for other conditions that are not COVID related, of course, in-person consultations will take place where the risk is considered reasonable. Occupational health as well needs to, of course, guide your policy and your guidance in terms of your COVID management plan. Keelan? Finally, it is critical and essential that consent is on board in writing at all times. So this involves you discussing with your employee that you would like a occupational health assessment to take place. It should be written in your safety statement, and it should be part of the employee handbook. Regarding when the employee attends the occupational health physician, whether it is remote or not, written consent should also be obtained, where we would email the employee a copy of their consent document. They would sign it. It's a one-pager where it's completed and their signature is required. The start of the consultation goes over the consent process again to ensure that there is comprehension of the process. It is absolutely reiterated that the nature of the relationship is a doctor-patient relationship. We report back to you regarding fitness for work status. We don't talk to you about the appendicitis they had, or the broken leg that they had, or the underlying medical condition they have. Typically, if the employee actually wants their employer to know about their breast cancer, we do mention it in the report, and that justifies recommendations that are put in place for the employer regarding the role that the employee used to have, and potential modifications and recommendations that are required as a result of the occupational health risk assessment. Clear advice from your occupational health physician is important. No woolly paragraphs are advised. It needs to be like 3 to 4 take-home messages at the end of the report. The report should get to you rapidly, because this is a rapidly evolving situation, and every day an employee is off work is going to impact negatively on your business. And trust, as well as a positive and constructive relationship between all stakeholders, the employer, the occupational health physician, the employee, needs to happen. The occupational health provider is impartial, objective, and evidence-based. That's what I'd like to say. Finally, yeah, so I'll hand over to Tommy now, but thank you all for the invitation to present to you today.
Okay, I'm back on there. Thanks, Dr. John. Guys, look, thanks for bearing with us. I know we've probably run over time a little bit more, but I appreciate you staying there. And just to remind you again, guys, we're not going to go into questions and answers now, but look, they're all sitting there. We'll print them all off. We will get back to you guys, all right, ASAP on the questions if unfortunately, and my apologies if I haven't gone into the type of stuff that you wanted to talk about. So look, just some key takeaways. Okay, look, you didn't need a webinar with a HR man like me to tell you there's a lot to do. Right, obviously physical changes you have to do in your shop, and the policy changes you need to make in terms of health and safety, in terms of occupational health, in terms of HR. All right, but look, all I'll say to you is the more shortcuts you take, the less effort you put in now, the more frustration there may be down the line, in terms of the risk of not being able to enforce certain rules against employees, in terms of customers having issues, in terms of PR. You know all of these things yourselves. All right. I think managing employees who are reluctant to concern, just get a process in place. Inform them of the status, like I said, about whether they're on layoff or off layoff at this stage, and then move on to their reasons in writing. Analyze it, get support on it, and we'll go back to the employees after that. And obviously then if and when decisions on labour costs are needed, you are getting into employment law territory then. You are getting into messing with core terms and conditions. So look, get some support, make sure your decisions are logical and not personal. And I'm thanks to Dr. John Crowley for his medical advice as well, because more than ever, it's going to be needed in the next kind of 6 months to a year. All right, so thank you all for your participation this afternoon.
Thanks, Tommy. So what we'll do is we'll take all the questions, have them all answered, share the Q&A sheet with everyone. So maybe tomorrow morning, Tommy,
Perfect.
after this, we'll send the video and send the slides. The joys of being a HR professional in retail today. Guys, you know, this is an amazing situation. And so don't be hard on yourselves. We can only try as best we can. And if we don't have isolation rooms and whatever, we just don't have them. So don't be hard on yourself. I suppose the Irish Times, Kieran Hancock, I shared future predicted retail revenues across 15 sectors. It's pretty dire, guys, and he's writing up an exclusive piece of the Irish Times in terms of what's going to happen. There are 400,000 people who work in retail, 288 directly, but another 30 in wholesale, and the rest are in services like payments and all the rest of packaging, store fitting. 400,000 people. We lose 30%, best case, which is 120,000 people. Tourism, we're losing 12,000 per year. And then chains that are reopening but shuttering some of their stores, that's another 25,000. So we're looking at about 160,000 job losses today. And we'll be talking to you about that tomorrow at 2, as we said. So, you know, I'm going to be very overtly critical of the government soon, and I'm going to need your support. So look, that's it. We are finally working up with Sea Change, an online COVID training solution. It's going to take a little bit of time, but please bear with us. So look, thanks to Brendan, thanks to Dr. Jan, and specifically Tommy, thanks to you and your team. Keelan and my guys, thanks for organising. So look, take care everyone, and don't be too hard on yourselves, okay? Thanks.